So you may have seen some videos online of chiropractors clicking and cracking the spine of people, making a lot of noise and often getting quite a lot of views. And you may be asking questions such as, what does this even do? Is it helpful? Is it painful? Does it hurt them? Or maybe you don't actually know what a chiropractor does. Maybe you don't know how we may treat people, and you're wondering, yeah, how we do that. Well, this is the video for you because I'm going to explain what a chiropractic adjustment is and what it actually does, and how we go about to making sure that it's a good thing for our patients. The chiropractic adjustment was actually what founded our profession. It was founded on the idea that if we make an adjustment to the spine in a very specific manner, that we can have profound effects on the health of that person. And I think the best way of explaining this is to really just explain what we look for on every patient when we come in, particularly as a Gonstead chiropractor, and what makes us different, what makes a Gonstead chiropractor different from a regular chiropractor is just the system that we use to specifically find and correct a dysfunction in the spine. This dysfunction that we're looking for may be referred to as misalignment, as a dysfunction, as a joint issue, as a subluxation. It has a lot of different names, but we're essentially looking for the same thing. And we have a 5-step analysis. The first step on this analysis is we are using our eyes. We are observing the patient. We're looking for things like the level of your pelvis, of your shoulder. We're seeing if there's a head tilt, if there's a curvature of the spine, or there's an increase of the tone of the muscles in that area. That can all start to build a picture of what's going on and where that problem actually is. The second thing we're going to look for is going to be instrumentation. So we have an instrument that we call the nervoscope, and basically what it is it has 2 prongs like this that runs along the spine, and it's looking at very small and micro measurements of heat as we go through. And essentially, if you've got a problem in a joint of the spine, it's going to increase the heat of that area. It's going to do that for a couple of different reasons. Firstly, a problem in the joint will tend to give a bit of inflammation, but secondly, as we get a problem in the joint, you'll have disturbances of some of the small nerves in the skin, which can then produce changes in temperature. So as we run this instrument down, we'll tend to see a spike of heat over that area. And again, that's adding to build to our picture. The third thing we look for is our static palpation. So we're using our hands, feeling over the spine, and we're basically going to look for things like swelling, because a joint issue will tend to cause a little bit of swelling, but also will tend to push over that joint. And if there's a problem with it, often it will elicit a little bit of pain. The fourth thing we look for is going to be the motion of that joint. How is that joint moving, and is it even moving to begin with? If it's restricted or if it's not moving in the right way, then that's going to cause a big problem within the spine. But also this is a finding that will almost always be present if there's a problem within that joint. And in the same way that if a car tire's not aligned properly, you're going to get more wear and tear in certain areas of that tire. A similar type of thing can happen with the spine. And then the fifth and final thing that we look for, and this is not something I personally do on every patient, but I would do on a lot of patients, and that's x-rays. X-rays gives us the exact structural alignment of the spine, and if we get a problem in the spine, we will almost always get a change in the position of that bone or that joint. And that then guides our adjustment so we can be as precise as possible, because specificity matters. And so all of these things that we're looking for will basically cause certain symptoms. There can be pain in that area, like back pain or neck pain. It can refer from the neck and go into the head, causing headaches, or it can go down the legs, like sciatica, or it can go above and beyond just pain in the spine. And so there are a whole load of symptoms that it can cause. And this is why chiropractors can have an effect on almost every part of the body, mainly because of the centrality of the spine mechanically, but also because of the neurology of the spine. And so once we found this issue, what do we do about it? Well, now after those 5 steps, we found a very clear picture, and this is when we bring in the chiropractic adjustment. And this has to be very specific, because we want to correct the joint. We want to correct that exact joint, and we want to correct it in a very precise manner, in a very specific direction, to restore that position and the motion of that joint, reduce that inflammation, and all those findings that we saw, we want to see improvements on. And this is what we look for as we start to treat someone, to make sure that we're making functional changes. Now, the adjustment, what is it? Well, we use our hands. It's always done with the hand, and we make a specific contact over that joint, and it's a quick movement in a specific direction. And with that, often you'll hear a little click or a pop. This doesn't always happen, but the majority of the time it will. Why does this happen? It's because as you move the joint, you increase the volume of that joint, which decreases the pressure, creates bubbles, and those bubbles just pop. It's not painful unless you're in a very acute situation, but often we manage that. But very rarely is it painful at the time. Occasionally, some people might just feel a little bit of soreness afterwards, but that's basically it. So this is what a chiropractic adjustment is. I hope that clears up some of the misconceptions about it. And I'm going to put a couple of videos at after this of me adjusting certain people, and what you'll see in it, you'll see how very specific it is. It's not violent, and we're only moving that one joint, and we're moving in a very specified direction. And you also see how comfortable it is for the patient. It's not painful. If you've got any questions at all, then please do put them in the comments. I'll be very happy to answer them. About anything to do with chiropractic. And if you've got any suggestions, any other questions you want me to answer, then please put that in there as well. Don't forget to subscribe if you want to continue to see this type of content, and I will see you on my next video. Have a great rest of your day, and I'll see you next time. Bye-bye.
Let's see.